I'm Gary Bloch. I'm a 2018 AMS Phoenix Fellow. My fellowship project has been focused on bringing the idea of addressing social risks to people's health to the center of healthcare practice, and especially primary care practice. This has been a wonderful and unique opportunity for me. I have been involved in this type of work for the last 15 years very intensively, but until the AMS Phoenix Fellowship came around, had never been offered an opportunity to really sit back, think about what I'd been involved in and the people I work with had accomplished, and then think about how we were going to take that to the next level. So through my fellowship, I've spent the first half of the time gathering information, just looking back at what we've been involved in, looking at what people are doing across the country and around the world, through examinations of the scientific literature, but also through conversations with primary care providers across the country who are deeply involved in this type of work. I've also brought together a group of people with lived experience of living at the social margins with homelessness or in poverty to bring their unique perspective as lived experience experts into the project and into what I'm doing. Through the second half of the fellowship, I expect to take that information and turn it into a model, and a model that can be used by other primary care health providers and teams across Canada and perhaps internationally to really bring action on social risks to health and action on health inequities right to the center of their normal everyday practice. This is a deep project. It's one that I think will be truly transformative for primary care in Canada, but will require a lot of work to bring it to the core and the center of primary care practice. This, to me, is intimately tied to the process of bringing compassion to the center of care within normal Canadian primary care practice.